Well, it's 7 p.m. So why don't we call this Board of Health meeting to order? It's January 19th, 2022. And we could do roll call. Candace Linehan present.
Laurel Gorville present.
Lane Silva present.
Awesome. And we're joined by Cindy Luongo, Anthony Choi, Maureen Busby. We also have some members of the press here, Mark Sardella and Mike Karagi. Welcome, everybody. Let me just look at the agenda. Do we want to start with the minutes, the 15th and the 5th? And then who's doing communicating COVID protocols and guidelines? Elaine, were you the one that was going to speak on that? Or Anthony, were you going to speak on that?
I'll probably cover some of it. I'm sure Elaine, Elaine, if you want to jump in and add some stuff, that would be good too. All
right, maybe we'll batch that with your health director's report then, Anthony, if you were planning to speak to that.
Oh, that's probably a good idea.
I'll make a motion to accept the minutes of the meeting on December, I'm going to read the right date, December 15th.
I second that. They look fine.
Yep, I agree. All in favor?
Aye, Gorville.
Aye, Silva.
Linehan, aye. I'd welcome a motion on the 5th for the minutes from the 5th also, if anyone would like to propose.
I'll make a motion to accept the meeting minutes of the 5th.
I'll second that.
Good.
Great. All in favor?
Aye, Gorville.
Aye, Silva.
And Linehan, aye. Excellent. So moved. Maureen, do you want to give your piece now, or would you like to wait until after the health director's report?
However you guys want to do it is fine with me.
Why don't you go?
Yeah, do you mind if Maureen just goes first so that we
I
can?
think I'd actually prefer it, because then maybe she could hop off if you had other stuff that you plan to do. And I noticed that we've been joined by 2 other folks here. Let me just check real quick. Is anybody on for public participation tonight? If you could unmute yourself and let us know. If not, you're of course welcome to listen. Any public participation? Okay, we'll close public participation then. Maureen, why don't you go ahead? Thanks for joining us.
Okay. Good evening, everyone, and thanks once again for allowing me to spend time talking about the tobacco program. Several months ago, I provided a quick overview of the state's new tobacco law. The focus then was recent sales to minors and the board's decision to waive the look-back period and treat all 6 violations as first violations, even if they had past violations, and also to waive the 1 to 30-day permit suspension that is now triggered by a first sale to minor violation. And I'll get into that a little more because the board probably will want to discuss that and make some decisions around that. Tonight, I'll provide a quick re-review, but this time the goal will be to provide enough information so that the board can determine if it is interested in bringing local regs into line with state law. State law trumps local regs if state law is stricter than local law. So for instance, if a violation earns a $100 fine under local regulations and a $1,000 fine under state law, that violation would now trigger the higher state fine. It's not critical to sync these, but probably advisable. Conversely, if you had a fine structure in your local regs that was stricter than state law, you could keep your higher fines and you wouldn't have to sync with state law. So what about the new law? Our state legislators passed an act to modernize tobacco control at the end of 2019. Some of the provisions in the new law were effective January 1, 2020, and some were effective June 1, 2020. I'll focus on the provisions that relate to tobacco sales. There are provisions that relate to smoking cessation benefits, the state's tobacco program budget, and other areas. This is a comprehensive law. We'll follow up with written documentation, so don't feel you have to take notes on all this. The flavored vape product ban, which is the most commonly understood or known provision in the law, was effective January 1, 2020. no flavored vapes of any kind, nicotine, CBD, or any other substance, with just 2 exceptions. Licensed facilities such as medical marijuana dispensaries and recreational pot shops can sell flavored vape products. And adult-only smoking bars can sell flavored tobacco products for on-premises use only. And Wakefield doesn't have any smoking bars. Some years back, Wakefield restricted the sale of flavored tobacco products, but those earlier regulations used the federal definition of flavored tobacco, which exempted mint and menthol. So even with that flavor restriction, the restriction where only adult-only stores could sell flavored products, even with that restriction, we ended up with a lot of menthol cigarettes still in our local stores, along with wintergreen and spearmint tobacco, chewing tobacco, and of course, mint and menthol vapes. Also in the new law, fines were increased from $100, $200, $300 to $1,000, $2,000, $5,000. The tolling period, which is like a probation period once a store has a violation, was increased to 36 months statewide. Several municipalities, including Wakefield, were already at 36 months. This probation period or tolling period, we also call the look back period. If a store violates tobacco law, we look back 3 years to determine if it is a first, second, or third violation. That determines if the fine will be $1,000, $2,000, or $5,000. It also determines the length of the permit suspension. No suspension for a first violation unless it's a sale to a minor, 7 days for a second violation, and 30 days for a third violation within that 36-month tolling period. State excise taxes were imposed on all e-cigarettes for the first time, which means a Department of Revenue license is now required for vape products so that excise taxes can be collected. A retailer may now need up to 3 DOR licenses, 1 for cigarettes, 1 for cigars and other tobacco, and 1 for e-cigarettes. You don't need to do anything about that DOR licensing, but I check for it. And if they don't have it, then they get a violation and a fine. And that you wouldn't have to make any decision about it, but it could play into the second, third violation down the road. Also, there's a lot of new signage. A retailer may now need up to 9 signs: minimum legal sales age, summary of new state law, flavor ban, e-cig warning, cigar warning, no smoking, no vaping, quit line number, entrance restricted to 21 plus, and even a smoking on premises warning sign if applicable. All customers must be ID'd. Formerly, retailers were required to ID anyone who looked like they were under the age of 27. Now they must ID all customers. Again, all sales to minor violations trigger a suspension of the local Board of Health tobacco permit, even a first offense. Prior to this, no suspension was imposed for a first violation. And this new first suspension has an additional wrinkle. Instead of a set, we know it's not 0 days, but instead of a set number of days, it's 1 to 36 days, and the local Board of Health decides. You may decide you want to predetermine the number of days and avoid having to meet every time there is a first sale to minor violation. Since the second offense triggers a 7-day suspension, you may want to select a number that's less than 7, say 3 days or even 1 day. Then every first sale to a minor violation would trigger that lower number of days, and it would be applied in all instances. Other first-time violations would not trigger suspension. So say somebody sold a cigar below the minimum price or sold a flavor product, that would not, if it was a first-time violation, would not trigger suspension, just the sale to a minor. Also, a so-called manufacturer's letter, that's our nickname for it, is now required for all nicotine products attesting to the absence of flavored ingredients. Essentially, the retailer must have written proof that any tobacco product they carry is not flavored. In the past, enforcement folks were trying to figure out which products were flavored and which weren't. Actually, we're still trying to figure that out, even with the new provision, and new products pop up all the time. Additionally, a manufacturer's letter is required for all vape products attesting to nicotine content, no more than 35 milligrams per milliliter, except for adult-only stores, which can sell higher nicotine content products. Underage buyers cannot be fined. The new law makes it clear that the penalty for sale to minor violations is assessed to the seller, not the purchaser. Also, a store cannot advertise products that are prohibited. No ads for menthol cigarettes, for example. Other older provisions of state and local law still apply. A local Board of Health permit is required, no sales in pharmacies or educational institutions, no coupon redemption, no out-of-package sales. Humidors and other self-service displays must be locked or out of reach of the customer. Liquid nicotine containers must be child safe. Cigar minimum price, permit cap, proximity ban, and ETS regs, that's environmental tobacco smoke regulations, including smoke-free workplace law, still apply. Obviously, we've had to do a lot of retailer education, many points of contact, including in-person store visits, as well as mailed materials. In the case of a violation, a store owner has a right to an appeal. Appeals may be made to the local Board of Health. Board members hear testimony from the retailer and from the enforcing officer and decide if in fact a sale took place and that proper protocols were adhered to. Because the new fines, the new state level fines exceed the so-called 21D ticket or civil fine limit of $300, if a retailer wishes to appeal the amount of the fine, they need to file an appeal in a state court. Now, what's new product-wise? Well, we're seeing lots of new products, that's for sure. In addition to an endless variety of e-cigarette products, we're seeing lots of Delta-8 CBD vapes. We can enforce flavored CBD vapes because there was no exemption granted for CBD, just for THC. There were a lot of other CBD products. So by the way, if I see flavored CBD vapes, I tell the store that it's illegal to carry them. There are a lot of other CBD products, as you know, creams, balms, tinctures, gummies, and other candy type products, even honey CBD straws. It's the responsibility of MDAR, Mass Department of Agricultural Resources, to enforce CBD regulations, but it appears that they just don't have the feet on the ground to be in every retail outlet that carries CBD products, and many stores do, even Whole Foods. That said, I do think we need to keep an eye on Delta-8 and other newer products. The CDC issued a Delta-8 advisory a few months ago, but it was just an advisory, not a regulation. So they said, yep, it can be dangerous, but they didn't issue any regulation around it. Kratom has also exploded. I know I've talked about Kratom in the past to the board. I used to see it in small amounts now and then, and mostly in vape shops. Now I'm starting to see it in larger quantities and not just in vape shops, and not just the powder. There are pills as well as powder and in capsules, and even liquid shots. I bring this up because this is what I'm seeing, not because it falls under tobacco sales regulations. This part's just meant to inform you. To wrap up, I think you have two major considerations. Do you want to update local regs so they line up with the new state law? If you do, I can ask MTCP to provide technical assistance. One of our TAs can prepare a draft regulation which will highlight those areas that are new and those which require a decision by the board. If you do decide to update regulations, unlike where you're adding a totally new provision to your tobacco regs, it's not considered necessary. It's not necessary to have a public hearing. In fact, even if you're adding a brand new provision, you don't have to have a public hearing. We've done that in the past as a courtesy to retailers and to the public. If you decide to consider any additional restrictions on, say, Delta-8 or Kratom or any other non-tobacco product, I would recommend talking to town council. There could very well be industry pushback. I would love to see one of our largest cities take this on, get sued, and prevail in court. That's how the blunt wrap ban was handled. We waited for the Boston blunt wrap ban lawsuit to be heard and upheld in court, and then other municipalities adopted it. But somebody has to be first. So those are the remarks that I wanted to make. I'm here to answer questions or to be available as you have discussions among yourselves, and I can pop in with any suggestions or answers that might help you.
So before we open it up to questions, I would just want to say thank you again, Maureen, for being here. I think it's really useful, just for us moving into this new year here to really talk about, some of the some of the priorities that we have surrounding tobacco. We want to make sure that, this year we take the time to address this, as we continue to work with COVID. Later on, we're obviously going to talk about COVID again, but I think it's important for us to make sure that we discuss, a lot of these other health issues that are still very important during this time. So thank you.
Thank you.
Laurel, why don't you go ahead?
Hi, Maureen. Thank you as always. I'm wondering if your TA could also do a decision tree. It would be super nice to, so I think we're suggesting sort of, sounds like we're going to color code our current reds going, that's the
Right.
same, that's different, that needs to be changed. So, but I think it would be interesting to do a decision tree algorithm and going, this makes this happen, yes, no. I mean, I don't know. I think you already do that in your brain seamlessly, but it would help. I think it would be helpful for the board to visualize.
So Laurel, I'm thinking maybe just a chart that shows all the regulations and that Wakefield has, state has,
Yeah,
and then what happens if that regulation or law was violated?
yeah,
$300 fine or $1,000 fine for a first violation, suspension or no suspension.
yeah, a chart or
Got it.
decision, it's something that just makes it a little bit more visual.
Visual, yeah, oh, I get it.
And I think it would be helpful actually to use that as a teaching tool. Because people will be like, oh, I didn't know that that's what that meant. I think it might give people a visual clarity.
We did something like that, Laurel, for the retailers, but it related to the products that they could sell. So here are the vape products you could sell. Here are the tobacco products you could sell. And I agree, a visual is easier for a lot of people. And I know from personal experience that as many mailings as I've done, not every retailer reads every piece of literature. So I think a visual is a great idea.
Not to mention,
Appreciate some clarity also on where we differ from the state regs. And I wonder if, I don't know, Elaine or Laurel or maybe Maureen, do you know off the top of your head, I guess I'm asking, was there any reason why Wakefield chose to have the regulations we have? Like, is there any history there?
Sure. So there are some basics, there's basic state law. So everybody has that. Then over the years and over, many years, and especially say the last 20 years, the different boards of health decided that they wanted to do more to reduce youth access to tobacco. So they looked at the science and said, what happened? If we raise the price, that helps. If we have fewer stores that have the product, that helps. We found out that flavor was a huge draw to youth. So we restricted flavor, and now at the state level, they banned it. Usually local board of health leads, and then enough municipalities do it, and then the state follows suit. With flavor, the state leapfrogged local boards and just went right in with a flavor ban because they got a lot of data, and they knew they had some leaders in the legislature, and they knew that kids were attracted to these flavors, especially with the new vape products that we've all heard about, especially when Juul popped onto the scene. So all of the regulations were either to reduce youth access, or maybe even in some cases a little symbolic. And that one I think is the pharmacy ban. A lot of communities felt that it didn't make sense to have somebody go and buy their heart medication and be paying for it and see a power wall full of cigarettes. So a lot of all of our communities did a pharmacy ban before the state did, and before CVS did their nationwide ban. CVS went nationwide with a no tobacco policy. But yeah, so there is history with that. And we did some of them in a bunch, and some of them we did one at a time. Laurel, you and Elaine, you've both been on the board long enough to know we did, a cigar minimum price, and then we did 21, and then we did flavor restriction, and so on. So we didn't always know when we were doing a review like this what the next product would be, or how much evidence we'd get that youth were attracted, or in the case of menthol cigarettes, how much evidence we have and we know about how minority communities were targeted by the tobacco industry. And in not so much now, but I'll say 5 years ago, I would see lower prices for Newport menthol in my urban communities than there were in suburban communities. So with that kind of evidence, the legislature felt strongly about doing the menthol ban, even though the federal definition of flavored cigarettes still exempts menthol. In fact, Massachusetts was the first state to do that comprehensive flavor ban.
So just so I understand, right now, it seems like some of our regulations are a bit more permissive, where our fines are lower than the state.
That's right. And it
Okay.
doesn't, yeah, right, on paper. And it doesn't really matter because we impose the state law, but it's just cleaner if they're synced up. So someone doesn't say, well, you gave me, when Cindy gives a new store owner a copy of the regulations, and they say, well, the regulations said $300. Now you're telling me $1,000. So yeah, the state law trumps, but it's cleaner if we give everybody updated regs that match that state law that we're going to impose. And again, you may have stricter regs. For instance, the state does not have a minimum cigar price. You do in Wakefield. Any single cigar has to be $2.50 plus sales tax or more. Any multi-pack, 2, 3, 4, doesn't matter. Any multi-pack has to be a minimum price of $5 plus sales tax or more. And so that can remain. We'll still do that under local regs. And those fines for those violations would be 100, 200, 300, unless you decide to change those. But sale to minor, sale of a flavored product, anything that's under the state law would have the $1,000, $2,000, $5,000. And I think that's why, Laurel, you asked for that, that visual.
I
Yeah,
think that's
Because of what I just said.
Yeah,
Oh,
we
really?
really need that. When you think back to when we started with the taking the tobacco products out of the drugstores, you know, pharmacies and things like that, where I was, we were the second community in the state to do that, and it was a hard fight. And I think you have to see where it's going. That if you go with the state, what is it really going to? How's it going to impact our community? What have we done? What have we seen that's successful? And then to see if going with them, if it's much more clear, because last summer, right, Marlene, if I'm not mistaken, we had all the confusion, Cindy, with all the new fines and all the new tobacco things. So I think that's what we'll have to do. I agree with Laura. We'll have to have some sort of a chart and take a really good look at it and see where we want to go with it.
I think also the history, you know, I think we've been really so fortunate to have our CADCA grant, which is what sponsors our wake up work, which also feeds into our youth behavior, you know, youth and risk behavior survey. So we have had a really robust data set that's very local. And this is, you know, I've been in this game, you know, Elaine's been in the game a long time, but on the public health side of things, it is always about local boards of health. You know, that our predecessors on the board took on getting smoking out of, you know, out of restaurants. So, you know, there was a time, I think there are people on the call who don't remember, but there was a time where smoke magically didn't go across a buffer. You know, you had to smoke, you know, you had a smoking section on a plane and a smoking section at a restaurant, you know, and you know, there was this outcry at the time that restaurants would lose business. And in fact, they didn't, because it turned out nobody liked smoke in their room, in their restaurant, including the smokers. So, you know, it really has been a culture shift. And then industry kind of went through the side door with a vaping phenomenon. And I forget Ms. Sabaro's first name, but it's
Cheryl.
Cheryl, yeah. So Cheryl
Cheryl.
was like, you know, the whole menthol thing was meant to actually anesthetize taste buds and the throat so people weren't irritated by smoke. So it's not just a flavor, it's a
Right. They smoke more.
So, yeah.
Yep.
So, you know, and now we're seeing the same tricks with the vaping companies. We're seeing the same playbook with marijuana. And so, you know, as I've told people, you know, I'm like, we are just trying to keep up with industry. And Maureen has been out there as our investigator superior, going, look what else I got. Your car smells terrible because you're always coming up with. So he's like, I just got, and you're like, what? Like grape?
Yeah.
So it's so interesting because we've been leaders in the data set, and Maureen, you've been unbelievable.
Thank you, Laurel, but I do want to second what you're saying, and I'll just give a couple of examples. I shared with Anthony recently that photo that someone gave to you, Laurel, that you gave to me of the cleanup at Lake Quannapowa on Earth Day, and with a bag full of used jewel pods, which not only was used in statewide meetings, but was Maura Healy took that picture to Washington, D.C. to testify before the FDA. So that was a Wakefield success story. But also when Maura Healy's office was had a public hearing on some vape regulations, so your youth action team had done a survey. It wasn't a YRBS survey. Separate from that, your youth action team had done a survey of high school students to find out how many would use this product or that product, if it was flavored, if it wasn't, and so on. And I don't remember the whole data set, but it was actually a relatively short survey. And I sent that survey to Maura Healy's team, and they have used that survey in some of their meetings, including the public hearing where we were very outnumbered by store owners and trade association people. So you're right, Wakefield has definitely been a leader.
So maybe what we need is that, like that Visio, that kind of side-by-side comparison, and maybe we could think about it this month and consider voting next month. Yeah, Laurel, Elaine?
Yeah. No,
Okay.
it sounds, if you can put that together, Maureen, and so that we can review it, then we can.
Great, we'll do that. We'll get
comprehend
you
it on the first pass. We can actually make a motion. Just have to understand it. So give us a week.
Yeah.
Right. So any other questions?
No, great job as always. We love having you.
Thank you so much, and thank you for your time.
Thank you,
And
Mom.
have a good rest of the meeting.
Don't tell them how I wanted to steal you and take you where I was working. I couldn't do it though. I couldn't do it.
It was close though, Elaine.
Yeah, I know. It was close. It was great. She was Anthony, for you, who, you've only been here for a few months with Maureen. Maureen's name was mentioned, and the respect that she has, and the leadership she has, and she's done a lot for other communities and coming in and speaking to them. I always had a problem. I used to say to them, I'll call Maureen first and I'll check it out with her.
You guys are making me blush.
It's good. You need it, Maureen, once in a while.
And you're great. You're a great team to work with. I love working with you. So thank you all very much.
Thanks, Maureen.
Good night.
Maureen.
Yeah,
Thank
thank you. All right, Anthony, do you want to do health director / COVID protocols?
Sure, yeah. So I think we'll probably just lump them together a little bit because there's a bit of overlap in both of them. But I'll start with the COVID-19 update and update to quarantine isolation protocols. So, since the holidays, there has been quite a few changes that have been made. Guidance coming down from the CDC and adopted by the DPH. There's been, separate guidelines and different programs adopted by DESE for the schools. Tonight, what I'll probably speak more to are more general quarantine isolation guidelines, because some of the changes for the schools are still somewhat in the air right now. There's a lot of changes today at one of the meetings, so I don't want to speak to that yet because we're still waiting for some developments to happen there. I'm sure it'll change by tomorrow. But so let me just give a quick overview. I can see Elaine's already entertained. She knows what I'm talking about. Quarantine isolation guidelines. This has been changed. So I'm going to go over some of the new definitions for quarantine isolation. Oh, not necessarily for those two, but also for tests and for vaccination status. I think those are some of the biggest ones, and just so everybody understands, we're on the same page here. So terms of quarantine, that is specifically for when you are exposed, when you've been in close contact with someone who has COVID-19. And so that's, within 6 feet for 15 minutes, I believe. So that's the definition of a close contact still, and you'll have to quarantine. And we'll go over the conditions under which you will have to quarantine. For isolation, those are for folks that have symptoms and are positive with COVID-19, even those that don't have symptoms and are positive for COVID-19. Isolation is staying away from others, and we'll go over the isolation time period as well. So in terms of calculating quarantine, when you've been a close contact, you will count from the date of your exposure. We'll consider that day 0. And so you have to quarantine and stay home and away from others for 5 days. So if we're counting the day of exposure as day 0, you would count the first full day, so the next day, as day 1. And you would count 5 days out, and you can return to activities on day 6, provided that you are still asymptomatic. And so one of the recommendations that we have is, if you are interested in testing, we recommend that you test on day 5 or later with the rapid antigen test. And so that will give you most likely the most accurate, assessment of whether or not you are positive. And so I think this might be a good time to jump into some of the definition changes. So currently, there are a few terms floating around. So if you're fully vaccinated, you are someone that has received their primary series of COVID-19 vaccines. So that includes either 2 doses of Moderna vaccine or 2 doses of Pfizer vaccine, or if you received the Johnson & Johnson vaccine. And so there's another term right now that is up to date, and that refers to if you have received the booster dose once you become eligible, and if you are in the right age group. And so currently, if we are talking about the age groups, everybody 5 and above is eligible for vaccines, and you are eligible for the booster once you are 5 months out from your second shot. The 12 to 15 age group was the most recently approved to receive boosters. And so if you are boosted, you are considered fully vaccinated and up to date. If you only have 2 doses and you are more than 5 months out from your last shot, you are no longer considered up to date, but you are still considered fully vaccinated. And so this has implications in the recommended quarantine and quarantine protocols. And so I'm going to go through a couple scenarios. This is by no means exhaustive. I think one of the things I want to give a shout out to are all of our contact tracers. Elaine has been doing a great job, but we have an amazing team of contact tracers at the health department that have been working at all hours, weekends, weekdays, at night. They've been working so hard to keep everybody in the community informed on policies to return to work, return to school, general safety protocols. They have just been working, so hard to make sure that we keep up with these guidelines and provide the right advice here. So in terms of the information we're going to go over right now, it's the protocols for those that are exposed to COVID-19 and are considered not up to date. So they have not received their booster and they are eligible to receive the booster based on their timing and their age. If you were exposed and not up to date, your quarantine period is at least 5 days. So we recommend staying home and quarantining for 5 days, and then wearing a well-fitted mask around others for another additional 5 days. And so and we also want you to monitor for symptoms for the 10-day period. Since you had close contact, and this is to make sure that if you detect any symptoms, you would want to get tested and you would go into isolation. And so we're trying to stress that, the mask wearing piece is really important. You should be wearing a mask around others. In the 5 days after you return from isolation, you should be wearing your mask at all times around others to prevent spread. And just to go off of some of the mask pieces as well, one of the things that we want to stress is that not all masks are created equal. We have been trying to stress the point that cloth masks by themselves are not the most effective. We want to make sure that individuals understand the surgical 3-ply masks, the KN95 masks, and the N95 masks are the preferred masks. And so those will give you the most protection. Those are, the most useful for preventing spread. And so so when possible, wear a mask at all times around others, and avoid travel until your 10 days are up, and avoid being around others who are possibly at higher risk. If you were exposed to COVID-19 and you were fully up to date, fully vaccinated and up to date on vaccinations, you do not need to quarantine unless you develop symptoms. And so we advise watching for symptoms for at least 10 days since you had close contact, and again, isolating if there are symptoms developing. One of the things that we wanted to go over was the testing. And so if you've been positive, if you've tested positive with COVID-19 in the past 90 days, you do not, and you are exposed, you don't need to stay home in quarantine unless you develop symptoms. Again, it's the same thing. We want to make sure that you are watching for symptoms for 10 days. And if you do have symptoms develop, you can isolate and get tested. And the last one we're going to go over, at least for now, is isolation. And so isolation is for those that have tested positive. It is a 5-day period. Again, it is either the first day of your symptoms or the positive viral test, whichever came first. That'll count as your day 0, and you will count out 5 days from there, and you can return on day 6. The return policy is the same. So for the next 5 days, we recommend wearing a mask at all times around others, and make sure that if you test positive, so you can have the option of testing, after day 5 with an antigen test, if you are interested to see if you are still shedding the virus. Generally, they have some ability to tell you that, but we still recommend that after the 5 days of isolation to continue to wear a mask for 5 days. So those are some of the changes. They were changed from 10 days to 5 days. And so some of these new definitions for fully vaccinated and up to date, we will be taking into account when we work with individuals on providing advice on return to work and return to school. In terms of the health director's report, one of the things that we wanted to update everybody on is that we're in conversations right now with surrounding communities. We've been talking about a possible collaboration on providing vaccine clinics, at least regionally. And so we're hoping to continue to implement our toolbox here. And so along with masks, along with along with masks and social distancing, we also want to provide vaccines as readily as possible. So we're talking with other towns in the area to see if we can provide more opportunities for individuals to get their boosters in their first and second shots. As the 12 to 15-year-old group was the most recently approved to receive their boosters, we will be hopefully holding some events in the near future to allow them to get their shots more easily. And then currently, just as an update, we are in the midst of budget season. And so within Town Hall, we are having preliminary discussions right now as to the budgets moving forward for all of our departments, health department included, and some of the things that we're hoping to address. And we'll discuss this in more detail in the future. But I think one of the things we're discussing obviously are the Arpa funds, how those will help further our mission, and making smart investments in health that will be sustainable for the foreseeable future. A lot of our focus now, rightfully so, turns to some of the effects that have been resulting from COVID. And so we're taking a long, hard look at mental health. We're looking at substance use. We want to see what kind of resources we can bring in that will really help bolster our efforts to bring in programs. We already have Youth Action Team, we have Wake Up Coalition. What can we do to really supplement and go above and beyond to serve these groups. And so we are in the process of developing, we're in the process of fleshing out some of these programs and some of the things we will need to carry on this work. And so we'll be bringing this in more detail to the board once we have more detail on that. So that's part of the work that's been going on right now in the health department, as well as the planning for future clinics.
Anthony, I feel like we have some blind spots. The whole country has some blind spots, and the CDC has certainly, the CDC has been taking heat, rightly so, on communication. Listening NPR, a lot of too little, too late. We're coming down on the surge. We'll have our Thursday numbers tomorrow night. We have a COVID call again Friday. I kind of feel like, and I wish more people were accessing the COVID call, because we actually could entertain questions. Otherwise, we're kind of an echo chamber of people who are in the know. We have been, the board has been challenged by both folks who came to the last meeting, and, some letters that we've gotten that, we need to do a little bit more. And it's funny, I think about, what we're tasked to do. And, I'll just go on record saying, I don't, I think there's a word going around called decision fatigue. And I think one of the decisions is, even though I see stuff that's coming down, I need to wait. It's really hard to, second guess these regs, and they're not nimble. They're federal regs, and we have to trust the science, and the science is solid. The timeline is nuts. So, it's unprecedented. So, things that we had time to get, I'll give you an example. I had a dental public health official tell me years ago that Suboxone strips are tough on the buccal mucosa, and they're seeing some dental decay. It had not been published until just now. Like, this was 4 years ago. So, stuff that people were observing 4 years ago is just coming to light now in published research. That's the usual timeline. It's a little late. This stuff is changing weekly. And I think the public, rightly so, is a little bit confused, because we have news agencies who are pushing the information out. And so I just, want to use this forum to remind people, we are watching the time. What we can do in a local level is watch what is happening with our town, happening with our wastewater, happening with our testing. For sure, we got into an impractical place with Omicron surging, people wanting to get together as they were promised to be able to do at Christmas time, and and ridiculous testing stuff. The one thing you didn't mention is the governor was announcing the other day. Governor, no, I don't know if we get any heads up. I'm always like, and here we go from the top. But so did DESE, are we getting rid of test and stay and then replacing it with just test weekly every family? What's going on with that? Or is that more to follow on Friday at the COVID?
So, I mean, you're asking a really timely question here. So one of the things that have been suggested is there's multiple routes, right? You can either go the remain on test and stay, remain on pool testing. If you were doing pool testing before, you can continue doing that piece, right? That is a option. The other option right now is if you opt into this new testing program, the Department of Public Health will be sending, and through DESE will be sending test kits to staff and students that opt in for testing, and they'll be receiving one kit for every 2 weeks. And so that's one test per week for students and staff that opt into this program. That would be basically replacing test and stay. Now, I'm not here to report that Wakefield Schools is now, getting rid of test and stay. One of the things, and I think what you've kind of hit on here, is that with all of these changes happening so quickly, we just need a second to sometimes, slow down, and before we just kind of react to this, right? So I've already been talking to Doug Lyons, our superintendent here in Wakefield Public Schools. First of all, I want to say Doug does a great job. He always manages to keep everything, in perspective. He takes the time to go through the data. He listens to community input. But what I will say is Doug has been in contact, and we've been talking about, the pros and cons that come with test and stay or with this new program, right? And so we don't have a whole lot of data to go on with this new program because it's brand new. And we just want to see, in terms of our population here in Wakefield, our school situation, what works best. And so obviously we have a timeline to be operating on. I believe next week, or might even be the end of this week, we have to kind of give the state kind of a heads up as to which direction we want to go in. And then next week, I think the implementation starts, right? So we have a pretty tight timeline here, but I'll be in touch with Doug to kind of talk this through as we move forward and see which direction makes the most sense for Wakefield Public Schools. But by no means are we committing to getting rid of test and stay in Wakefield at this moment. We are kind of talking through our options.
Mm-hmm. Yeah. I mean, it is a public health evolution in thinking, because we've reached this place that's untenable, and we're in the tipping point in what we're doing. And oh my God, for all of you school age parents out there, I mean, it's just, my neighbors who are, they're all joking about doing like an SAT logic exam on if someone was positive and somebody else was exposed. And so it's a wild environment. We are trusting, a lot of personal responsibility out there. The parents have been incredibly, that I've seen, who just, I know they're exhausted, because again, it's decision fatigue. It's like, is that a sniffle? Is it COVID? Are you home? Do you stay home? Very impressed with the way Doug Lyons presented his case, and the way he's gifted in his word, the way he puts his words together. Very human, very compassionate. Like, of course you can stay home. I mean, it's been a wild ride. So thank you for staying with us, and more to follow. Yes.
I think that one thing too, Anthony, is that a lot of people, when your test results are done, that's a big thing I'm finding. And I feel very bad calling people. I mean, we have people calling us at 9, 10 o'clock at night, calling in home, they want, advice. And I refer them now over, especially to the website here in Wakefield, because Jen has done a phenomenal job with keeping up with all the changes. And people don't understand that their test result, when it's positive, is sent to the state sends it to Maven sends it to the local health, and then we as the traces pick up the phone and call the people. And people are leery of answering phones. And where do we put our priority? That was the thing 3 weeks ago, was local boards of health. It was up to us to decide where the priority of tracing was. Now they've kind of helped us a little bit in the reporting system, is that we have below 18, 5 to 15. So our reports are coming in that we have to run every single day now. It's not like it's all coming in together. Every single day you've got to run a report of the different age groups. So that's helping us to see where we see that high and where we'll have to go for tracing. And it's just very confusing, because I sat here the other day and I said to someone, okay, wait a minute, it's 12 o'clock. The governor was just on at 10. He said one thing. I just did a webinar that said another thing. And then DPH is at 3. So by 5 o'clock, turn on the early news at 4, and you'll probably have a whole different ballgame. And it was. And even tonight, I was listening to something. It's completely different. And I think in working with the public every day with the tracing, is I some days I'm very, very frustrated, because I have to sit here and look at papers and everything else to make sure I'm telling them the right thing. And then they see something different. And lately, most people feel bad for us, because they say to us, how do you in public health keep up with this pace? Number one, as Anthony said, traces, we're working 7 days a week. and that's weekends and holidays. Although Anthony did give us Christmas Eve, Christmas Day, New Year's Eve, and New Year's Day off, but let me tell you, we were tracing. It didn't matter. We had to. There's cases that come in, and the priority is there. We know as tracers, these are priority cases. We've got to get them, especially during Christmas vacation with so many children home. And I just want to I just have to thank the general public for being as kind and patient as they are with us and understanding we're in the same position as them. You know, we see the changes every day, and we're trying to get the best of information to them, and it's not easy at all. There's a new app out. Anybody know it? Mass Notify, where you can go into your notifications and you can register so that if you get that, the state wants to know why people aren't using it. You know, people say they don't like to share their business. They're afraid of information leaking out. I mean, that's the world we live in right now. And it's been very frustrating, I'll tell you, for tracers the last week or two, just the volume and the people and the changes. Even local, a lot of businesses will not change. They will not change to 5 days. I told you, Anthony. They're very adamant, and they all have safety health offices, and they're keeping people out 10 days. That's their prerogative and their choice. And it's very difficult when you call and you explain to them, this is the CDC, this is the DPH, this is what we've adopted. But if that's what your employer wants you to do, as long as you follow us in our guidelines until you go back to work. And that's one big thing I have to say, but I just can't help but thank the general public this week. I've had nothing but the most nicest people. In fact, I've got kind of friendly. I've had one calling me every day for 3 days. I don't know. I might get invited for a holiday dinner, maybe. I don't know. That's it.
Yeah, and I think, you know, part of it, I think part of what Elaine's saying gets to, you know, the point is we're all in this together, right? And it's not, you know, there are no teams here, and you know, the guidance changes because there is new evidence, right? And so we're hoping to flex along with it. And you know, it's sometimes it is frustrating. Sometimes we don't know exactly when the next thing is going to drop and when we're going to keep up. But that's part of our jobs, and we're trying our best to keep up with it. And hopefully, you know, it sounds like most of the public is very understanding. And you know, at the end of the day, we're helping them safely get back together with their families, safely go back to work. You know, so I think it's important for us to continue doing that.
Great. Anything else, Anthony?
That was it for me, but if there were any questions, I think I covered mostly everything that I was going to say, but if there's any questions, I could definitely answer them at this point.
I just want to give, you know, I'm just thinking about how we get involved with vaccine rollout again. And the stuff takes planning, and I think we're getting judged on the, like, why wasn't this, you know, why didn't you think of this? I'm like, we did a 12-hour clinic the Monday before Christmas that was just 4 weeks ago. The ordering of this, you know, and I have advocated for, you know, really understanding what the resources in the community are as well. You know, we know that our farms, you know, we have really learned that we have to partner with our pharmacies and other sites. And, you know, my worry is that our vaccine's going to come in and we're going to realize that, you know, everybody's all set. So, you know, I hope people understand that it's difficult to put this on a dime. I mean, between 4 weeks ago, they changed the recommendations on boosting adolescents and also changed the timing from 6 to 5. And so we were limited by that. It's just, I mean, we're all just kind of like, okay, you know, luckily color is catching up. I thought it was very interesting on the notification from Color that they are advocating that there be a paper backup, which, you know, we've been saying from the beginning. We're like, okay, you know, like, let's just keep going and write it down, forget about the tech. So what a ride we've all had, and we're still on it. I don't know what part of the roller coaster we're on, but we'll see.
I think, yeah, I was like, go ahead.
No, go ahead, because I was going to pivot to wake up stuff.
Okay, so that's probably a good place to go right after this. So what I was going to say was, even though we are still interested in providing, the vaccine, the booster, we obviously have plans to do that, in the near future. One of the things we have to remember is, as part of our group in the area of surrounding cities and towns, there are a lot of resources, and we don't want to be duplicative, right? And so we have other folks that are putting on clinics. I'm going to make one example right now. Medford has a clinic coming up at the Council on Aging, which is close by. It's in Medford. It's on Friday, I believe, and I can put this information out afterwards. It's from 9 a.m. to 11:30 a.m. They're providing both Moderna and Pfizer vaccine. I believe it's 12 years and older. So anybody can go get their first shot, get their second shot, and can get the booster if they need it. So we have a lot of resources in our surrounding communities as well, and we work as a team, right? Our clinic was not only attended by Wakefield, it's attended by Melrose and by Medford and by Malden. I think as we work as a team, we want to make sure we make all resources available within Wakefield as well as the surrounding community.
And all that stuff is on the MassVax site. So again, it would be redundant. I just think people have to think a little more broadly about this, but however everyone can do it, we're for it. And we will try to do the holes. Does anyone have anything else about COVID before I switch over to Wake Up? I just want to let you know that Wake Up is still doing amazing work. Amazing. So they still have their youth action team. We're still meeting monthly. Everybody is now remote again. Just amazing. It's just an amazing place to go. I asked that the board be sent minutes and agendas. Have you guys gotten them? No? All right. So I will speak again to powers to be, because we tend to meet right before, on Tuesdays, and Board of Health tends to be on Wednesdays, but I will double check on that. So that was one thing, not getting meetings. So one of the things that Catherine Dingra and Kara are working hard on is getting Parent University back again. And that, and some more parent enrichment things that kids are doing, other things are happening besides COVID, and it's refreshing to know. One of the other big pieces is that interface is again seeing referrals rise. There was some quiet time when people were just kind of stuck, but they are seeing the rise. So people are recognizing that they need some extra mental health work. You know what interfaces are referral source to match people to therapists and providers on the mental health side of things. So it's pretty cool. The other thing that's going on is we have had, the department still has Narcan to dispense. We have I don't know if the board is aware of that, but we're also getting fentanyl testing strips. They have them at the police department, and we have some at the health department. So what I asked folks to look for is that it occurred to me, kind of, nurses are used to point of care testing, and even just experiencing different COVID antigen test over the counter, you're like, oh, well, this one is more eco-friendly, but takes one extra step. Sort of, mistakes can be made, so people have to be really careful. So we're working on trying to get a visual or even a YouTube saying, this is how you would test your stuff. And so I've asked them to reach out to street teams so they can figure out what substance. We think fentanyl's in everything. We know that some people pop it in pop. We know that it's in cocaine, but people are using their drugs in different modalities. So, how to test it is something that we need some street teams to tell us. So that's kind of a point of education. So all that work is continuing to happen, and I'll make sure you guys get the minutes. And then the only other thing I wanted just to mention that I've observed and I've asked Catherine, but Cindy, you might be able to help us, and Anthony, is just let us know when someone from the health department is presenting to town council or anybody else. One is, I just like to know, because you know, we should know how you're presenting and what you're presenting. So for instance, the Water Street property that we had been hearing about, Coral did an excellent job in presenting that to town council. But I don't know if you guys have noticed it, but people use Board of Health and Health Department interchangeably. So therefore, anytime someone uses Board of Health, I sure as heck don't want to be behind in the communication. So, you know, the heads up. What's nice is everything is being streamed on Facebook. So I find, or, you know, or the government channel. So I do sometimes pop onto those things, but I think if we could get a bi-weekly, they have called us again, and then we may have to work talking to our, you know, to our partners who are on these boards to say, hey, you know, what else is going on? And Anthony has to work for 2 towns. Does he always have, like, you know, maybe we have to start sending surrogates, because they always want to hear. And I think we have to be smart and say, you know, we have a COVID call and it's recorded. So I just feel like we need to be very smart about the redundancies in our communication. And if there's anything that we can do as board members to kind of make people recognize that, because this crisis is now 2 years old and it's hard to maintain crisis mode. That's all. I'll make sure you guys get those minutes.
Anything else? Any other thoughts? Next meeting?
Next meeting, it's booked, isn't it? Whoa.
16?
That's what I have, 7 p.m.
That's school vacation weekend. So that's
School vacation is the following, actually. That's not, so the 16th is the week prior to school vacation.
Thank you.
I can invite my kids to the meeting if you want.
That would be nice. I would like that. I'd like the opinion of someone else.
Yeah, speaking of entertainment, Anthony.
Yeah, I would really like to know what's going on in the younger. I
You
really
need
would.
A
Because
live reporter from kindergarten.
yeah, I get the report from the preschool about the mask and who didn't have the mask on, and he had it down over the nose, and you know, how come he has a superhero one and I gotta wear this one, and you know.
You know, Elaine, I don't think that's a bad idea. Kids present to school committee all the time. I think we should.
I love it. And I'm going to tell you, in one group of parents and children, Anthony, we failed to mention tonight is the children in daycare. These parents are really struggling with this. I mean, you send the kid on Monday afternoon, you get the thing that the daycare is closed, so it's closed for another week. And it's an inconvenience. I feel bad for these parents. They have to juggle their work, and then they have to call the grandmothers, the aunts, the neighbors to try to, you know, who's going to watch my kid and who wants to. And I think that they should be commended. These parents have done a marvelous job with cooperating with public health. They really have been well. And I would love to hear the girls' opinions on COVID. I have, my grandsons built a great big sphere thing of COVID. And they built their own little molecular thing. I mean, it looks good, though. They did a good job.
That would be refreshing.
Yeah, it would be.
That said, I'll make a motion to adjourn unless we have anything else.
No, I think, yeah, we'll plan for February 16th at 7 p.m. Anybody up for seconding that lovely motion?
I will second that motion.
Excellent. All in favor?
Orville, aye.
Silver eye.
Linehan, aye. So we'll adjourn at 8:04 p.m. on January 19th, 2022.